I'm Joshua Elston, and today we're talking about fat transfer breast augmentation, otherwise known as natural breast augmentation. Natural breast augmentation seems to be growing in popularity, partially because patients are waking up to the fact that they don't have to do breast implants. When we're talking about the differences and similarities between traditional breast augmentation with silicone or saline implants and fat transfer breast augmentation, they both provide enhanced breast volume for the patient. I think the difference is the way that we achieve that. So with traditional breast augmentation using an implant, you're using a medical device. It's a sterilized silicone implant that goes either above or under the muscle and provides a stable amount of volume to enhance the breast. With fat transfer breast augmentation, we're harvesting fat from some unwanted area. Sometimes it's the abdomen, the love handles, the thighs, and then we're processing and then transferring or injecting that fat into the breast tissue itself. Over time, it's very stable. It'll grow and shrink with you as you gain and lose weight. It's not this fixed structure like a breast implant would be. So it'll change with you as you change, and that'll make the breasts appear more appropriate as you age. It can correct asymmetries just as well as a silicone breast implant. Also, it helps to improve your silhouette in other areas because we're taking fat from an unwanted area and transferring it to the breast. Most patients, when they come in looking for breast augmentation, they're on the fence about do they want to do implants or do they want to do fat transfer. So for me, I've just drawn a line in the sand and I don't offer silicone or saline breast implants. I think over time they create more problems than they solve. I mean, sure, they give you great stable volume because you know exactly what you're going to get with the implant, but over time they'll cause the breast to droop, or they can cause painful scars, or they can even cause other diseases that we're finding about over the last few decades. So for me, I just don't want to be on that side of history. I don't offer them. My preference is to do fat transfer breast augmentation. One of the questions I get from patients is the fat going to melt, or how long will the fat transfer breast augmentation last? So the fat is permanent in the same way that if you had a burn and we put a skin graft on you, this is a fat graft. It's a fat transfer of your own tissue. So once it gets blood flow and it becomes part of your body, it's permanent. I tell patients about 60 to 70% remains over time. With a breast implant, if you put in 300 cc's, 300 cc's stays. That's just the nature of those. With fat, if you're only getting 60 to 70%, maybe only 225 cc's of that 300 stays around. So you have to account for that and how much fat you transfer, but you can expect that once it is engrafted and it's taken in your body, it's stable. It's not going to go anywhere. One of the conversations that we have in the consultation about the pros and cons of fat transfer breast augmentation usually centers around, why we should do it or why we should not do it, or who's a good candidate and who's not. I think the patients that are good candidates are those that want a modest increase in breast volume, like a half a cup to a full cup size, and they have some areas of unwanted fat that they want to use for the transfer. Other patients that aren't going to be a good candidate are someone that has unrealistic expectations about the size increase. They're an A cup and they want to be a D cup like that. You can't really do that with one procedure. A reason that a patient may not be a good choice for this procedure is they don't have any available fat to transfer. So if you're going to take on the risk of surgery, obviously you want to have some type of benefit that comes from it. So if we're trying to scrape fat from like every single area on your body and we can't really get a whole lot, it may not be worth your time and money to have the procedure done. But if you've got one or two areas that are really bothersome, you've got stubborn fat and you can't lose it, this is going to be a really good option because you can get a little bit of breast enhancement while also taking care of an area of unwanted fat. So the fat is much softer and it doesn't exert the same projection or force as an implant. So really only a half a cup to a full cup size increase is possible in one session. The benefit is that you can have multiple sessions. So if you're looking to go for a full cup or a cup and a half, you can do that, but it might take more than one procedure. For very petite patients, you may not be able to transfer a lot of fat because they don't have a lot of breast tissue. They may need more than one session, and that's something that's really important to talk about because someone shouldn't come in and expect that it's only going to be one procedure when they might need two or maybe even more fat transfers. The cost for the fat transfer breast augmentation is going to vary, and it mostly scales with how many areas that we do liposuction on. So each subsequent area that we do liposuction on adds cost to it, but you can check the website for the most up-to-date pricing. We include one area of liposuction with the fat transfer, so when you see that price, that's kind of like the baseline that you can expect, and then the more areas that we do lipo on, it's going to increase the cost. If you decide that you want to do more than one session, or if that's what I recommend for you, then obviously there's going to be increased costs with increasing procedures as well. So the recovery for fat transfer breast augmentation is interesting because people that come in and they want to get their breasts enhanced, they assume that that's where the pain is going to be. And for most patients, the breasts are actually an afterthought. They're not that painful, not that swollen, not that bruised. It's the areas that you have liposuction at that are really bothersome. So those areas are usually tender, not painful, or people will say that they're achy. The pain is usually most severe the first day, but after that it tapers off pretty quickly. And then the thing that bothers patients long term is just the swelling and puffiness that's associated with liposuction. So I joke that over time, the breast results get worse and the liposuction results get better. So with the liposuction, you start out swollen and over time it gets better and better. With the breasts, they start out swollen, which is the desired effect that people are trying to achieve, and then they get less and less swollen. So people will often come back in after about 6 weeks and they say that they really liked the way that they looked the first week out and they wish they were just a little bit more full. One of the no-nos after fat transfer breast augmentation is sleeping on your chest or wearing anything compressive. So it's one thing I always counsel my patients on, that you want to take any pressure or any sleeping or anything like that off of the breast so that the fat has the maximum amount of blood flow to it. We don't want it to be compressed or crushed, and that only lasts for about a week or two, and then you can start sleeping on your chest again. I think the best candidates for this procedure are somebody that wants something subtle. If somebody wanted a really out there augmentation that really stood out, they would probably go and get breast implants. Most patients that want a little bit more volume but aren't seeking that augmented look, this is a really good opportunity for them to discuss it with a plastic surgeon. The best way is to set up a virtual consult. It's complimentary, and you can just ask me questions. We'll figure out if this is something that sounds like it's a good procedure for you. Some patients find out that what they actually need is a breast lift, or some patients realize that they don't have enough fat for transfer and it's not going to be worth it. But you don't really know until you set up a consultation and ask. So that would be the next best step for anyone that's made it this far in the video.